This is Nell, and I have joining me in the studio today, Dr. Tony Coppola with Gundersen Decorah Family Medicine. And today, Tony, we're talking about vitamins and supplements. Do we take them? Do we not take them? Is vitamin deficiency something that you find to be a common problem with your patients?
You know, that's a good question. We hear a lot of talk about nutrition and vitamins and supplements here in the area in which we live. It's a popular topic, and people around here generally like to take good care of themselves. And so the good news is we don't see a lot of vitamin deficiencies in our practice, especially if people are getting a balanced diet. So that's one of the things we always emphasize right from the young kid physicals all the way to adult physicals is making sure we're getting a balanced diet, getting all our nutritional areas covered. Mm-hmm. Now, if people have like problems with absorption of nutrients, or they've got digestive problems, or they're on unusual or atypical diets, then sometimes you're at risk of getting a nutrition deficiency in that case. I don't see a lot of those, fortunately, like I said, but one of the things we see low, not uncommonly, is vitamin D level. And that's because, first of all, of our geographic location, mm-hmm. kind of in the northern part of the United States, and a limited sun exposure. And then also, in folks that are light-skinned individuals, they may be at more risk too, because the skin is needed as part of the activation of vitamin D in our body.
So what can you do to get more vitamin D?
So, there's lots of things you can do diet-wise. For example, some of the foods that are high in vitamin D are milk or dairy products like cheese, eggs. Some cereals and orange juice are fortified with vitamin D. Some fatty fishes like salmon can have a high vitamin D content. Mm-hmm. Mushrooms, actually, interestingly, have a pretty good amount of vitamin D. And then the other thing is sun exposure, like I mentioned before. So, getting 15 minutes of sun a day can help boost those vitamin D levels. In the winter months, that's obviously harder. And so a lot of times vitamin D levels will sag during the mm-hmm. winter months. But yeah, getting some sunshine is good in that regard.
And will vitamin D deficiency affect your energy levels?
It shouldn't directly affect it too much. The most common thing we see is people having bone density problems and even increased fracture risk with vitamin D deficiency, and sometimes also calcium absorption problems because that vitamin D is important in the way we absorb calcium.
Okay, well, I'm going to go find myself a glass of milk. Thanks so much for joining me today. That's Dr. Tony Coppola with Gundersen Decorah Family Medicine.